Hello, I'm Ted Gottlieb, certified senior advisor, seniors real estate specialist, and founder of the Senior Learning Institute. The Senior Learning Institute is all about providing free education and resources to older adults and their advocates. This Senior Learning Institute educational moment features physical therapist Dr. Brooke Kalisiak, the president of Legacy PT. This conversation is focused on the bladder of all things. As we age, Brooke, what's considered to be a normal bladder habit? How often should we be going during the day and going at night?
Yeah. So one of the most common issues that I hear people coming to our office for is bladder issues. And those especially get more common as we get older. And we'll talk about that a little bit. But let's start by talking a little bit about some of the norms. So it's normal to be going to the bathroom every 2 to 5 hours during the day. And anywhere that should in a 24-hour period lead up to anywhere between 5 to 7 times a day. And so that number might surprise a lot of people because they might be like, wow, I'm going a lot less than that, or I'm going a lot more than that. But those are the averages that are there. You should be able to make it to the bathroom, feel a normal urge and make it to the bathroom without having to worry that you're going to wet your pants, honestly, and that you shouldn't have to know where every bathroom in the city is or feel like you have to plan your day around your bladder. It should be something that you feel like you're in complete and total control of. During the night, people should be able to, as we age, it is normal to get up once a night. And then as we get above like that 70 to 75 range, it is normal to potentially be getting up twice a night for your bladder. But anything more than that is extremely disruptive to sleep and can really help with or be harmful for all of the good benefits of getting a restful night's sleep.
So the frequency that you mentioned and that range, is that dictated by consumption of coffee, water? I mean, what dictates that?
So fluid consumption will play a role in that, but you shouldn't have to limit your fluids to manage your bladder. Okay. So the norms I just talked about going 5 to 7 times a day should be with you consuming a normal amount of fluid. And I put that in air quotes because that changes person to person. So that old adage of everyone needs to drink 8 ounce glasses of water a day really isn't true. I tell people to go by the color of their pee. So usually your first pee in the morning should be a bright yellow, and then any subsequent pees after that should be a pale yellow. So if you are peeing clear, you're probably drinking too much fluid. And if your pee is like a darker yellow, then you're probably taking in too little fluid and need to increase it. And so that's actually one of the faulty things that people do to try and control their bladder is they actually limit their fluid intake. And that can make your bladder actually more irritable because urine can irritate the bladder lining and is in its concentrated form. The bladder wants to actually get rid of it faster. So the bladder can actually try and send you a stronger urge to get rid of it. So it can backfire by and end up making you go to the bathroom more frequently or more urgently by trying to limit the amount of fluid you take in.
Wow. Okay. So as we age, what are the more common bladder issues?
So two kind of main areas. One is urgency and frequency. So urgency is just that feeling of I gotta go, and it can be worrisome whether or not I'm going to get there in time. And so as we age, our bladder becomes a little bit less extensible. It doesn't stretch and hold as much. And so it might start to tell us more often or more urgently that we need to go to the bathroom. Frequency is just that we're going to the bathroom more often. So again, if our bladder isn't stretching as much, the tissues aren't as elastic, the bladder is going to start to tell us potentially that we need to go to the bathroom more often. And that can start to get disruptive to the day. Take that a step further, and where it really starts to become problematic for people is when we have the bladder leakage side of things. So that can happen in the urgency situation, and that's called urge incontinence. That's where you get the urge to go and you can't get to the bathroom in time, and you have some leakage that occurs. And leakage is defined as a few drops or Niagara Falls. It's anywhere in between there. It's based on you losing urine at a time where you don't want to be losing urine. So Your urge incontinence happens when you feel the urge and you can't get to the bathroom in time. Stress incontinence, the other type of bladder leakage, happens with an activity. Oftentimes it's a cough, it's a laugh, it's a sneeze. Maybe you go to lift something a little heavier. Maybe you used to do more higher level fitness activities, but you stopped running or jumping or squatting because you started leaking when that happened. And that's where, unfortunately, we see a lot of people start to do this downward decline. So they limit their activity to avoid leaking, and then they become less and less active. And, working with the senior population, how detrimental that can be. And it just really, it can be this downward spiral. So our mission at Legacy is to make sure that people aren't going on that downward spiral because of their bladder, and making sure that they can stay healthy and active and in their homes.
Got it. Now, you mentioned bladder shrinkage. What are some of the other issues that are common as we age?
Yeah, so as we age, certain factors can play into us having these bladder issues. So one is that we see a decline in how our nerves and our muscles are interacting with our brain and our bladder. And so though that interaction can slow down and potentially lead to us experiencing some of the bladder issues I talked about the elasticity of it. The bladder is like a balloon that fills and expands. And as we age, we do lose some elasticity in our tissues. And that's why it is normal for us to have to get up during the night when we're older, just simply because the bladder can't go quite as long. Women kind of get a double whammy on this, in that once they hit menopause and their hormone changes, their hormone levels change, that does affect the elasticity of the tissue as well. And so that's why it's very common for women to start to see bladder issues happening when they hit that menopausal time of life. The other thing that can happen is as we age, it's not uncommon that we're experiencing different medical conditions. So an example would be arthritis, limiting someone's motion because of pain. They're not able to get up as often, get up as fast as they used to, and maybe have trouble getting to the bathroom, or it leads to less and less activity. That leads to decreased muscle strength and potential problems. So those are all examples of ways that things that happen as we age can contribute to what's going on with our bladder.
So as we're starting to get older, is there anything that we can do to be proactive that would either prevent or slow down these bladder issues?
Yeah, that's where we come in as pelvic physical therapists. We work with people all the time who are trying to get control of their bladder issues or prevent them from happening. Many people may have heard of the pelvic floor muscles. Many may have not, but the pelvic floor muscles are a group of muscles that are on the bottom of our pelvis, and they are involved in our normal bowel, bladder, and sexual function. And these are muscles like anywhere else in our body. So if we don't use it, we lose it. And so the most common thing that people hear associated with the pelvic floor muscles is doing what's called a Kegel exercise. And that is simply a contraction of the pelvic floor. So while we're sitting here talking, you could be practicing that. You could think about trying to squeeze like you're trying to hold back pee or gas, and then letting that contraction go. And so that's a way that you can kind of work out that muscle throughout the day. And the beauty of it is it's a hidden exercise that no one has to know that you're doing it, and you can kind of fit it in anytime, anywhere.
So if someone were going to invest their time and energy in pelvic physical therapy, how much time could they expect to have to do this? I mean, if I'm coming in right off the street and I've got an issue, when can I expect some relief?
Yeah, no, that's a great question. And so we start out with everyone kind of figuring out what is your main issue. So the first appointment is a full evaluation, looking at or talking to you about what's going on with you symptom wise, and then evaluating what's going on with you and your body. So looking at your posture, your movement, your muscle strength, your coordination, and coming up with a plan to, get muscles stronger that need to be stronger, or work on bladder retraining, or talk about different bladder irritants. So we tailor the program specifically to each patient based on what is going on with them and their bladder issues. And then typically people can see improvement in the first couple of weeks. I'm not a big fan of doing anything for an extended period of time and not seeing changes for the better. So a lot of times simple changes can make big effects when it comes to your bladder. So We're oftentimes working with people on a once-a-week basis for anywhere from 6 to 8 sessions to really get them to their goal of, if it's to be completely leak-free or to be able to make it through their favorite movie without having to get up and go to the bathroom, or maybe they're getting up 3 or 4 times a night and they would prefer to be getting up once or twice a night. It really depends on what the patient's goal is. There's a little bit of time and effort that's associated with it, but really there's a lot less risk and potential side effect issues than adding another medication to your regime or potentially undergoing a risky surgery. That's the beauty of pelvic physical therapy, is there's relatively low risk or side effects associated with it.
Wow. Do you typically work in conjunction with my primary care physician, or is this something that typically, someone will either come to you or you'll be referred to you, but how much communication?
Yeah. So a lot of times, or by Missouri state law, we need a physician's referral for physical therapy. So oftentimes if the patient has heard of pelvic physical therapy, or that they're talking to their primary care physician, or if their bladder issues are bad enough, they may have already been seeing a urologist or that, and they can ask for a referral to pelvic physical therapy. We always like to partner with the patient's physician to keep everyone in the know and in the loop on what's going on, so that, we're kind of managing the patient as a whole and making sure everything's moving in the right direction. But if you are hearing about this and you think it's something that you want to try, you can definitely give our office a call to learn more about how we can potentially help you out, or how pelvic physical therapy can help you out to help make that decision. And we'll help guide you as to what needs to happen and how to potentially get the prescription. So I don't want you to feel like you have to navigate the medical field by yourself with it.
Okay, so could you actually call my primary, or how do you typically go about it if someone were to call into you and say, I want to try this?
So we can do that evaluation appointment without having any type of referral in place, but then we would need to get it in place. So typically, if it's a doctor's office that we have a relationship with, we're happy to give the doctor's office a call. If we haven't worked with that doctor's office before, oftentimes it does come better from the patient themselves calling the doctor's office and asking, but that's something that we talk with the patient about to try and make it as easy as possible for them.
Got it. And typically, will Medicare cover the services?
Yep, it's covered just like regular physical therapy. Everyone's like, oh, pelvic physical therapy, that's completely different. And honestly, it's just regular physical therapy in a private area of your body, and it's covered the same as physical therapy in general is. So yes, if you have Medicare, that's one of the insurances that we take, and it is a covered service by Medicare.
Right. And do you typically see more men than women, women than men? Are men welcome? Is this a men's thing?
So men have pelvises too, and do have pelvic floor muscles. So yes, we work with a lot of gentlemen who are dealing with pelvic pain or bladder leakage issues, especially as we age. Prostate issues can come into play, and women seem to be taught from a young age that they have a pelvic floor, with us having babies and stuff like that. We have more of our lifetime where we potentially know that there could be an issue down there. And for gentlemen, it seems to be that they're not necessarily realizing that there's a muscle down there that they can work and use. And so if they do have a prostate issue and end up having to have some surgery or changes are done with the prostate, that can end up causing some bladder leakage issues. And so that's a common time that we work with them, because frankly, they oftentimes didn't even realize that they had some muscles down there that they could use.
If someone wants to get a hold of you, Brooke, what's the best way for them to find you?
Yeah, the best way to find us is at our website is legacytherapystl.com, and our office phone number is 636-225-3649. And we know that a lot of people may be hearing about this as pelvic physical therapy as an option for the very first time and have little understanding of what it might entail. And because of that, we like to offer what's called a free discovery session for people, which is just a 20 to 30 minute appointment with one of our pelvic physical therapists that's free. It can be done over the phone, over Zoom, or in person. And it's just to let you kind of tell your story and learn a little bit more about what we may be able to offer, and for us to learn a little bit more about what's going on with you, to see if our practice would be a good fit for you. So it's something we put out there just because we know this can be kind of a new and delicate topic for people to talk about.
Yeah, absolutely. And it's a new and delicate topic for the Senior Learning Institute. We haven't gone south of the border before. So
I love it. I love that we're bringing it south of the border.
yeah,
That's
absolutely. Awesome. So thank you for doing that. We appreciate that. And we hope people take advantage of your generous offer to have a consultation, because I think that will go a long way. All right. So your phone number again is 636-225-3649. It's legacytherapystl.com. And feel free to look Brooke up, and she'll be happy to help you out. I want to thank you all again for listening to the Senior Learning Institute Educational Moment. At the Senior Learning Institute, we strive to provide the straightforward information you need to help make smart decisions the first time. It's unbiased and it's really free information. So we love to connect older adults and their advocates to the resources they need, from everything from aging in place to selling the home for more, no matter the condition. State and financial planning, in-home care, estate sales, clean-out services, you name it, anywhere in the U.S., we're happy to help. To learn more, please visit us at theseniorlearninginstitute.com. Until next time, I'm Ted Gottlieb, certified senior advisor, seniors real estate specialist, downsizing coach, and founder of the Senior Learning Institute.